is Monday, July 27th, and you're getting the real deal with Dennis Neal. CNBC Reports starts right now.
Let's bring in the Real Deal squad. Bernard Whitman, CEO of Whitman Insight Strategies, is here. Greg Knapp, radio host and op-ed columnist for Washington Examiner. Jack Berkman, the Republican strategist, and Leslie Marshall, host of her own radio show. Leslie, he was an awfully silver-haired, silver-tongued doc there making that argument, and frankly, I agree with him. Can Obama do anything to save this troubled plan?
Well, I wouldn't say everything he says talks about a troubled plan or about the president being able to save the plan or not. One of the things they're talking about is taxing an elective surgery. A cosmetic surgical procedure is not the same as something that is necessary to save one's life. I say this as not only the wife of a physician, a surgeon, but also as somebody who co-owns a medical center. Regarding the reformation of health care in this country, it's needed. This plan, what plan? There's a president's plan, there's a House plan, there's a Senate plan, there's a division between Republicans and Democrats on the different plans. I don't hear a plan, Dennis, and quite frankly, I don't like all the plans
between
that I'm
Democrats.
hearing.
Jack Berkman, talk about the blue dogs taking health care hostage.
Oh, I love it. For the first time in a long time, some good Republican news. The thing is, Obama's under attack from the right with the blue dogs and the left. Now, let me make a prediction here. Hillary Clinton is marginalized, frustrated, and out of the health care game. I'll make a prediction. You can play back the tape. Within 90 days, she will leave the State Department. She will re-enter New York politics. She will win as governor or senator, and she will primary Obama, arguing that he betrayed the left on the promise of health care because Obama this fall, whether he likes it or not, to save his presidency,
he'll have to withdraw from it.
I'm sorry. This is the fantasy. This is the fantasy of the far right.
That is a fantasy.
Go ahead, Bernard.
This is absolutely a fantasy of the far right. Here's the issue. Your segment earlier talked about how healthcare sector is starting to drive the economy. I think that raises the issue of cost, and I think the one place where Obama fell short is by not making the entire healthcare reform from the beginning around cost controls. The Blue Dog Democrats are now exercising.
Wait a minute, I disagree with you there. This is the cost reform plan, not
what I would call real
plan.
politic. And I think it was a huge mistake for the president to not position the entire health care reform from the beginning around cost control.
Here's the thing, though.
Middle America is most concerned.
Greg, can the president save the plan?
Yeah, the thing is that he wanted it to be about costs, and it's not working. The CBO scored every bill that's out there, and they all stink. They're going to jack up the deficits, jack up the debt. Costs are going to go up. Quality is going to go down. They're already having to raise taxes to pay for this thing. It's not what he wanted.
But you're not factoring
what that doctor said
of covering the uninsured.
I agree.
Hang on one second. I love what that doctor
said
said about free markets, because I've been saying it and I get yelled at on the show. We don't have a free market for health care. Higher health savings accounts. Give the tax break to an individual like you give to a business. Have real free market competition across the states and let the patient and the doctor work this out instead of calling the doctor a bad guy who gives
Leslie, isn't there a chance here that this plan improves? Leslie, isn't there a chance that this plan improves because of the opposition of the Blue Dog Democrats?
Can't get worse.
When you just focus, I don't care what political party, and if they're only caring about their political party, even though I'm a liberal Democrat, and not people and health care that needs to be reformed, and not just the cost that needs to be reformed, we're going down a very dangerous slope, my friends, because let me tell you, unless you look at every area, when you have 6 insurance lobbyists to every 1 congressional member, every 1 senator, that's what Secretary Clinton
Guys, you know what? Viewers can't understand you, and they hate it. And I don't want them to hate it, okay? Jack, take it.
Sorry, Dennis. Let me offer a still bolder philosophy here. There is no problem. I mean, if you look at, I'm a single guy. I pay about $300 a month in health insurance, which is $3,600 a year. If I had a wife and 2 children, which I didn't, the bill would be about $14,000. When Obama and the Democrats come out and say people pay $14,000 a year for health insurance, I say, so what? What does that mean? People are going to have a bunch of kids and they're going to dump the bills on the state and on General Electric and on Procter & Gamble, and corporate America has to pay these bills? Here's what I say. There is no health care problem.
What do you say, Bernard?
The entire thing is an illusion.
The amount of money that we spend, tens of billions of dollars on health care right now for the uninsured, that cost is borne by every single one of us. It's a fundamental drag on the economy.
And you know what, Bernard? With reform, that cost is going to be borne by 1% of us instead of all of us.
Putting it on taxes does not make the cost go down. This is not about Republican or Democrat. And obviously, Leslie, we all want people to have good health care. But you have to pay for it. It costs money. I mean, one of the reasons it's gone up is because we have these great medicines now and great surgery, and people are living better than they ever have.
Where do you get this idea this is a free ride?
It's not a free ride.
Where do you get the idea that this is a free ride? It's not. I pay for Medicare.
Don't put words in my mouth.
I'm not 65 plus.
Medicare and everybody's paying up faster than private insurance.
We're paying for the elderly. Why shouldn't we pay for the uninsured? Because what we're doing is not only hurting our economy, but we're hurting the true physical, actual health of our nation. Remember, like in many managed care plans, when you have the quantity of numbers that a physician is seeing go up, the quality goes down.
And the additional
it's going to get worse.
Guys, we got to leave it there. We got to wrap it. Please let me have some type of authority. Thank you very much, guys. Much appreciated. Next up,